Professor Dayman Johnson is President of the Academy of Medical Sciences. Good morning, Professor Johnson. Looking at the position nationally, I've just been talking to Kevin Fenton in London, but looking at the position nationally, how far do you think we are into this Omicron wave?
Well, it's important to note that there's been big variability across the country. We saw this wave arrive first in London. And if we look across the rest of the country, the rates of infection are still increasing in all areas except London. You heard from Kevin Fenton that there may be some slowing in London. We're not seeing that elsewhere. So other parts of the country are still are still seeing rises, and we don't know how far that's going to continue. That said, rates in London are still higher than in the rest of the country.
The Health Secretary says that we don't need boosters, or a second booster, I beg your pardon. Do you agree with that?
Well, I think there's very good news coming from the UKHSA this week, and also from the considerations of the Joint Committee on Vaccinations. And what they've shown now with new data is that if we look at people who've had the booster, who are over 65 and are now 3 months from their booster, what we're seeing is that the boosters are holding up in terms of greatly reducing the risk of having to be admitted into hospital. And that's a really important result, even though we know that people 3 months beyond the booster have less protection from getting infected. Nevertheless, they retain the protection from having been admitted to hospital. So that's a very important result. But obviously, this will be kept under review as we get more data moving forward.
An important issue here is how people behave and how they respond to the information that's put out there. Now, I've just been talking to, as you heard, Kevin Fenton, and he was saying young people who feel that they've had COVID think that to some extent they're immune, they don't need to be bothered with the vaccination and so on. What more broadly, people are now believing, and there's some evidence, that Omicron is less severe than Delta. Are you worried at all that what's now going to happen is that people might be less cautious because they think, to some extent, we're coming out of the woods?
Well, I think it's very important that we recognise that people have substantially changed their behaviour during this wave and since Plan B. So the data show increased use of face coverings in crowded places. People are clearly using tests when they're going to mix, particularly with people more vulnerable than themselves. So people are assessing the risk. Moving forward, though, we need to recognise that we are now building up immunity in the population, both through vaccination and through natural infection. What will be important in the future is whether other variants emerge that are either have caused more or less illness. So we're going to have to keep a close eye on that. But people have responded quite substantially. My concern now would be going forward, is we will see changes in behaviour again, obviously, as schools go back, people return to work. So there'll be different patterns of behaviour, and we'll have to watch very carefully how much infection goes on being transmitted. But we also need to think about how we most effectively respond in terms of, for example, being able to keep people at work and so on.
Of course, I've been saying this morning, COVID is the big story in town, but I think it's probably wise not to forget that there is such a thing as conventional flu. Are you worried about the impact of flu this winter?
Well, I would just remind everybody that every year we see flu being transmitted in the population, and very often the flu season, if you like, doesn't start till the end of December or going into January. So but at the moment we have very limited flu activity. That doesn't mean that we shouldn't see more. What I would emphasise is that we should remember that the pressures on the NHS are not just COVID and Omicron. There are also other respiratory viruses which we see in winter, like respiratory syncytial virus and other viruses. So people are in with other conditions as well. And we need to watch carefully for flu. Two things are important that we've already done to mitigate against that. First is that we've had a very good vaccination programme for flu this year, higher uptake. It's been done along with the boosters. And secondly, the behaviours that people are changing to reduce risk of transmitting COVID will also limit the transmission of other viruses like flu and other respiratory viruses.
Dame Anne, thank you so much for such a comprehensive briefing this morning.
Thank you.